But one of the most important things, other than the fact that we need to spend less money, or rather spend our money more efficiently, was the fact that Sir Jonathan Michael, felt that healthcare was delivered directly from the minister down through the chief executive. So there's a very big political influence on the way healthcare is delivered on the Isle of Man. And so one of the big things that he recommended, and in fact Tynwald have agreed, is that there's going to be a new healthcare board set up called Manx Care, which will be separate from the politicians. So it'll be a separate independent board run by clinicians and managers who are directly related to the care that's being given. So I'm not going to say any more about that because I'm not an expert, but just wanted to say that is probably one of the most important things that you need to know about the difference. Now I've locked myself out of my iPad, I can't actually see what I'm doing. So yeah, we talked about 8 key areas, and some of them are more interesting than others. I'll just go through them in order and tell you a little bit about what needs to change. So public health is the first. Public health is, most people really know about public health because they talk about things like flu jabs and epidemics and all the sort of stuff that affects us as a population. And what the report said is that there isn't enough information being given to the general public about the services that we deliver, the resources that we've got, and how we can plan better care. So public health department is being moved into the Cabinet Office, and it's going to have a much bigger profile in giving us, the general population, more information about the care that's going to be delivered. Primary care, which I suppose is my biggest area, the biggest problem we've got is that we have more patients per GP on the Isle of Man than they do in England. And so obviously GPs are busier than they are in England, and we rely also too much on the doctors and not enough on our practice nurses and our pharmacists and our other healthcare. In the UK, again, practices are run much more on a sort of multi-skill, multidisciplinary basis, and we want to move towards that. So that's primary care. We also want to work to bring together primary care and community care, and that's always a bit confusing, but community care includes people like community nurses, district nurses, health visitors, midwife, specialist therapists, podiatrists, people like that. And in recent years, the two, primary care, where your doctor and your practice nurse are housed, and community care have become rather separate, and the thought is that we really need to bring them back together so that they're working better together, so that more services can be delivered in the community, as I said right at the beginning. And the plan is to move quite a lot of things that are currently done at Nobles Hospital in the outpatients department, and one really good example of that is diabetes care, where at the moment anybody who's diabetic will know that most of the time anything other than dietary advice and the most basic testing is done by outpatients in the diabetes department at the hospital. It's thought that that's not really the best way of doing it, so we're planning to move that in the main out into the community so that it's done closer to your home by people who know you best. So that's one really good example. Social care, again, not really my area of expertise, but at the moment, social care is focused very much on people living in care homes instead of in their own homes in the community. And again, we want to try and make sure as much as possible that you can stay in your own home for as long as you can with the right support in your home. Most people want that. At the moment, we're not able to do that as much as we'd like to, so there is a move to do that. Children's social care is actually working quite well, but there's a feeling that there isn't enough support given to make sure that children get good support throughout their whole childhood. There tends to be a focus on when you're a very small baby or if you've got particular health problems, but the thought then is that we really need to get social care working throughout childhood right up until adulthood. So hopefully there'll be some changes there. Third sector, that's always a bit of a funny one because people don't really understand what the third sector is about. Well, those are really community organisations, charities, private sector organisations that provide care. You'll know things like some of the alcohol support services, youth clubs and youth services, learning disability services. There are a lot of sort of charities that will support those, which don't get an awful lot of airplay, don't get a lot of advertising, and we want to make them much bigger profile, and we want to be working much closer to them and getting them integrated into community and primary care too. Lots of people interested in, I've just mentioned the word integrated, and that's people will have heard that quite a lot in recent weeks and months. The whole integrated care philosophy means what it says on the tin. We want to try to bring together the various bits of healthcare that are being provided at the moment in sort of separate pockets and bring them together so that they're all housed under one organisation, that you only need to ring one person to get directed into the right place of care. That's what integrated care really means. Out of hours services, I'm involved in meds and have been for some years. And at the moment, we have two very separate organisations. We're number 6, by the way, out of 8, so we're nearly there. Out of hours services at the moment are again provided in pockets. We all know, don't we, that our A&E department is overburdened. There's lots of long waiting times there. Patients get fed up sitting in the waiting room, and a lot of folks go there and then find that actually A&E is not the right place for them. They should really be treated somewhere else. So there is a plan to try and integrate our out of hours services much better, so that we're working alongside each other, the GPs in meds, the doctors within A&E, and indeed the nurses as well, plus the ambulance service, plus a new family of practitioners called urgent care practitioners, UCPs, who are being trained up. They'll either have been nurses in previous life or paramedics in their previous life, and they're being trained up specifically to look at urgent situations that can happen either in the home or in the community or in the A&E department. And they are going to be quite important in helping to deliver care as time goes on. Number 7, services based in the hospital. We've left that to last, really, because in some ways we're not going to be doing less in the hospital, but there is going to be more moved out of the hospital into the community, so that we can concentrate on the hospital doing what it does best. That is treating really ill patients who need to be in bed, being looked after by specialists. In many ways, as I've said, there's lots to celebrate. So, but hospital services cost a lot of money, and so we just need to make sure that the money is being provided for the right services at the right time, and that stuff that doesn't need to happen in hospital doesn't happen there and is dealt with elsewhere. And then finally, number 8, mental health services. Huge area, which we've spent time talking about before on this show. Actually, mental health services in some ways are more advanced in their progression than others. There's been a new strategy out, 5-year strategy, for 2 or 3 years now. So actually mental health services are moving very well in the direction that we want in terms of, and many people know this, in terms of moving services into the community. So we've already got counselling services, for example, out in the community. There's a new online counselling service, which I'm going to talk about again in the next month or two. I've actually just done a video in the last day or two, and we'll point to that once that's out and published. So there are new services there too. Mental health services are expanding and are going to be much more provided in the community. So really, you'll have had a theme all the way through this. We're moving care closer to where you are, closer to your home, trying not to make sure that you're in hospital or in a care home unless you absolutely need to be, and treated hopefully by people who you know in your local community.